I had just started studying to become a speech-language pathologist, and in all honesty, I had no idea what I was doing. I think the reason I'd kind of gone into it was because I thought it revolved around two things that I really loved: talking and people. But as I sat there that night, studying for my anatomy exam the next morning, my world changed. It started with a short and simple text message. Dad had a stroke. He's in the hospital. And as I sat on my bed, rereading the message again and again, my imagination kicked into overdrive. It probably didn't help that at the time I was also studying about stroke, but these what-if questions just kept on soaring in. What if he doesn't get better? What if he can't walk? And at the time, I never imagined, what if my dad has aphasia? Aphasia is a communication disorder which affects speaking, understanding, reading, and writing. 1 in 3 individuals who have a stroke will have some form of aphasia, which may last hours, days, or a lifetime. And while there's various types of aphasia, the majority of the causes of aphasia is from stroke, but can result from any type of brain injury. Now, I can see there's quite a few of you looking at me a bit blankly. Chances are many of you have never even heard this word before, and that's okay. A recent study that was done in Canada, Norway, and places like Argentina found that people don't know what aphasia means. And when these participants were asked to talk about what they thought it was, they guessed it was either a type of exotic fruit or a funny skin condition. The people who did know what this term meant only did so because they had been affected by it in their own lives. So let's maybe start with the basics. What do we know about stroke? We know that to prevent strokes, we need to live healthy lifestyles. We need to monitor our cholesterol and blood pressure levels. We know that things like diabetes, smoking, and being overweight puts us at a larger risk for having a stroke. I don't know how many of you guys watch Dr. House on TV or have seen terrible shows like Grey's Anatomy, and many of you have probably heard the acronym FAST, which we now use to help identify if somebody is having a stroke by looking for facial drooping, one-sided arm weakness, and slurred speech. But what I think is most alarming is what research is now saying about people who've had a stroke and are now living with aphasia. These individuals, who once lived active lives, are now being viewed differently. They are known for having smaller social networks, higher incidences of depression, and have difficulty returning to their activities of daily living. But I'm not really interested in talking to you about the research or what you're quite capable of looking in a textbook to find out. What I really wanted to share with you today was the individuals that I get to work with on an everyday basis who are amazing. I think for me, the term aphasia is so mind-blowing because it happens every day, all over the world, and nobody knows about it. I really wanted to give you guys a picture of what is going on. Aphasia is a difficult concept to understand because often the people who've suffered from it are able to receptively understand what you're saying to them, but cannot verbally reply. Can you imagine what your world would be like without words? Would you be able to run a successful business meeting or go on that date? But how do you think the people around you would respond? So I really wanted to introduce you to some people that I work with. Now, Jan and Laverne have been married for a number of years, but unfortunately both suffered from a stroke within a few months of each other. So Jan, who you'll see, has difficulty finding the words that he'd like to say. He has an anomic type of aphasia, where Laverne has a severe Broca's aphasia, where she knows what you're saying to her, but she cannot get the words out. and currently the only sound that she can make is ta-da-da. And as you can see from the video, they are excellent communicators, even though they can't always speak. And they're like every other married couple who are able to argue and joke. I also wanted to share with you some of the other stories. And what we've done is we put together a visual campaign that's going to be running during Stroke Week. So for all of you here, you can take out your diaries. It's the last week of October, and we're trying to send this message. And the core message comes from individuals who've had strokes and who are living with aphasia. And what we did was we asked them to send a message of hope to other stroke survivors, or to write down a message they wish that they had been given after they'd had their stroke. So this is Miriam, and Miriam had a stroke a number of years ago. And after her stroke, like many stroke survivors, she just wanted to be included again. And I think we often take for granted how we build and we maintain our relationships. We share about our experiences, we ask for support, but what's so important is that she needs that additional support and that help. Miriam is rather exceptional as well, is that she's taken a potentially life-changing event and found her own positive slant on it. I'm happy to inform you all that she's even won a silver medal post her stroke, and she's still learning new skills to this day. Martinez is the perfect example of how talking isn't everything. And as a speech therapist, I'm sure that's not something you'd expect me to say. Talking is important, but it's not the only way that we can get a message across. Martinez really wanted you to know that no matter the fact that he can't get his words out, he is still an adult, and he deserves to be treated like one. Just because he can't say it doesn't mean he's not competent and isn't in charge of making his own decisions. But I think one of the main themes to come out from my discussions with my patients is the fact that they feel that everyone views them so differently. Yes, something has happened to them, but aphasia does not make them a different person, as Gavi illustrates so well here in the picture. I think for all of us, if we take out a photograph from 5 years ago and have a look, chances are you've changed. Perhaps you've got a different hairstyle, perhaps you've put on a bit of weight, chances are you've aged a little. But underneath the wrinkles and the few extra kilos, you are still you. And that is the same for a person living with aphasia. We're not the same person we were in high school, and thank goodness, because as we go on with life, we do have our victories, our challenges, our heartbreaks and epiphanies. But at your core, you are still you. So my talk only has one key point that I want you to remember. Aphasia is a reality, and we need to start talking about it for those who can't. Thank you.